We'll grab our foam roller, beginning with unilateral rolling of our calves. Let's start with your dominant leg. Fingertips are facing the buttocks or to the side. Soft bend in the elbows. You should be rolling from the top of the calf, right near the knee, all the way down to the Achilles, keeping the leg parallel and the foot dorsiflexed. You can play around with external rotation of the leg from the top of the hip socket. Keeping the foot dorsiflexed is important with flat back posture to combat the plantar flexion in the ankles. Now let's start to focus on our breathing. Thinking about how we're breathing is important in learning how to contract the deepest layer of your core, the transverse abdominis. So before we begin, make sure your tailbone is reaching back towards your hands behind you, so you have a little lumbar extension, and you're bracing your abs like you're going to be punched in the gut. Now go ahead and switch sides. And once you're set up, inhale through your nose. Pull your belly button in towards your spine like you're putting on a tight pair of jeans. And lift up internally on those muscles that stop your stream of pee. Hold that lift with your belly pulled in towards your spine and sustain it as you exhale the air out of the mouth like you're fogging up a mirror. You should feel a low belly burn. Inhaling through your nose, pull the navel in towards your spine. Lift up internally, so this isn't a movement that anybody would visually see. This is an internal lift of the muscles that stop your stream of pee. Hold that lift and fog a mirror with your exhale, sustaining the lift of the pelvic floor. One more time, inhale through the nose. Draw the belly button in towards the spine. Brace those abs, keeping the brace. Exhale the air out. We'll set the foam roller to the side and grab our anti-burst ball. Come to lie on your back, supine, and slide the anti-burst ball under your sacrum. Find some lumbar extension, taking your pointer fingers and bringing them to the bony protrusions of your hips, guiding them down so that your low back is arching. Keep your abs braced here to support the low back in this position. And now guide those bony protrusions back to a neutral pelvis. Moving back and forth from extension to neutral pelvis will feel great for releasing the low back before we begin our lower ab series. Exhale as you slip into extension, moving down into that low back arch, and inhale as you bring it back up to neutral. Exhale down, inhale up, and exhale down, inhale lift. Small movement, just an isolation of the pelvis. Using the breath, using those contractions of the transverse abdominis, the navel to spine, the lift of the muscles that stop your stream of pee. Let's take our hands down to the ground, pressing our arm extensors, the triceps, the wrists, the palms, into the ground to stabilize the torso. Think about your sternum melting in towards your spine and your back ribs pressing heavy into the floor. We're going to float up our non-dominant leg. So whichever leg is the weakest, whichever side of your abdominals is the weakest, it's usually your non-dominant side. From here, we're going to take tabletop lower and lifts. On a count of 3, we'll lower, and on a count of 3, we'll lift. Inhaling to lower with a dorsiflexed foot, 2, 3. Exhaling to lift, 2, 3. Inhale, lower, 2, 3. Brace those abs, reaching the tailbone away. Exhale, lift up, 2, 3. Inhale, lower, 2, 3. Brace the abs. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Brace and lift, 2, 3. Make sure the rib cage isn't pushing out, that you're keeping those back ribs pressed heavy into the floor. The sternum is melting in towards the spine. The shoulders are melting down the back, not elevating up near the ears. Go ahead and switch sides after your next one. Setting up with a nice dorsiflexed foot, working for pelvic stability, so watching out for rocking in the pelvis here. Lowering on that 3 count, pulling the abs in, lifting up on the muscles that stop your stream of pee to lift the leg back up. We inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, and make sure when you bring the leg up, the knee doesn't track close to the chest, that it's tracking right over the hip. This will really challenge the lower abdominals. The more you bring the knee in towards the chest, the more of a modification you're doing, and you're going to grip and use more quad and hip flexors. We want to train the low abs here. We'll get into quad and hip flexor work in a bit. After your last one here, place the foot down and pick the pelvis up, sliding the ball out. We'll put it between the inner thighs now, opening our arms out to a T, imprinting the backs of the arms, the knuckles, the shoulders, and make sure that the wrists are not above the shoulders, that they're slightly below. Imprint the back ribs, close the rib cage, sternum melting in towards the spine, reach the tailbone away from you. Find that lumbar extension and float your legs up to tabletop. We're going to take some supine twisting for the transverse abdominis, taking the knees to the right, head to the left. At the bottom, we pulse in on the ball. 2, 3, 4. Pause, inhale, brace your abs, and bring the legs back up to the starting position. Make sure the tailbone's reaching away, creating lumbar extension, and other direction, twisting. Exhale, pulse in on the ball. 2, 3, 4. Inhale, prepare. Brace the abs, and exhale, lift back to center. Inhale to lower the legs. Exhale to squeeze in on the ball. 2, 3, 4. Inhale, prepare. Exhale, come back up to tabletop, remembering the knees are tracking over the hips. They're not pulling in towards the chest. Tailbone reaches away, sternum melts in. Taking it to the other side, inhale down. Squeeze, 2, 3, 4. Inhale, prepare. And exhale, lift back up to center. Let's do 2 more on each side. Taking that twist, squeezing in, 2, 3, 4. Inhale, prepare. Belly button to spine. Lift up on those muscles that stop your stream of pee back to center. Inhale to the other side. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Brace those abs. Exhale, bring it back to center. Feet are dorsiflexed. Tailbone reaches away from you. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Exhale, back to center. And last time. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare, brace, and exhale, lift back to center. We will come off of the ball, setting it to the side. We're going to we'll take the ball and we're going to place it behind the shoulder blades. We're going to work on our rectus abdominis, and we'll take the hands behind the head, tucking the chin to create a double chin to engage the neck flexors. Feet are on the ground, knees pointing up to the ceiling. Slow 3 count up and 3 count down, pressing the back ribs into the ball as you go up and down, reaching the tailbone away to keep some lumbar extension. Exhale, lift up. 2, 3. Inhale, lower. 2, 3. Exhale, lift. 2, 3. Inhale, lower. 2, 3. Exhale to lift. 2, 3. Inhale, lower. 2, 3. Keep that tempo going. I want you to think about your sternum, reaching for your spine, your back ribs pressing into the ball both when you go up and down, tailbone reaching away. We're working the outer upper layer of the core here. One more. Great work.